So sometimes the best answer you can get from a surgeon is it depends. Because that means that they are thinking through your case, that they have multiple options available for you, and they just need a little bit more information to give you the 1, 2, or 3 best options for your case. That in contrast to maybe somebody who's a little bit more dogmatic, where let's say everyone who comes in who has the diagnosis of arthritis, regardless of the extent or the location, gets one answer, which is you need a knee replacement, maybe now or maybe in a few years. So let's say you have arthritis in the medial compartment of your knee, so the inside. So the answer then for me could range from, well, if it's not that bad, you don't have to do anything. You're not causing any damage. Continue doing, just listen to your body. It could be, let's think about doing some oral supplements, whether that's turmeric or glucosamine, vitamin E, fish oil, but of course also things like Advil or Leaf. And they can all help some. But if you only have mild pain, maybe that's the solution for the time being. Or maybe it's injections like hyaluronan, PRP, sometimes cortisone if you have an acute flare. But sometimes you need a little bit more, and then there are things like a medial unloading brace, for example. It could be surgery. And what do we have for surgery? Well, sometimes we do cartilage repair if it's more of a focal defect. Sometimes we may talk about an osteotomy, a high tibial osteotomy, let's say if you're bow-legged and you're overloading the medial side. Sometimes it could be something called MISHA, M-I-S-H-A, which is an implanted shock absorber. And yeah, sometimes it could be a partial medial knee replacement. So, like I said, it really depends on your situation, how much pain do you have, and how much damage do you have. But for that, you need good imaging, good x-rays, alignment views, MRI scans, and a physical exam, and then we'll have a discussion. Take care.